Representative Bohr.
Hi, everyone. Good morning to Senator Kirshner, Representative Porter, Senator Cabrera, Representative Sanchez, Senator Sampson, Representative Aurora, and all the members of the Labor Committee. Thank you for allowing me to testify today. We have spent significant amount of research, discussion, and conclusions regarding the recognition of mental health on par with physical health. And it is time that workers' compensation laws need to reflect that understanding. And that is why I'm here today in support of Bill 666, which would provide workers' compensation benefits for correctional staff, emergency medical staff, and dispatchers. And through Bill 660 would evaluate providing these benefits to all professions. We now understand that a mental health impairment is as disabling as a physical impairment. Today, there is far more scientific evidence and sophisticated knowledge regarding the causes and seriousness of mental and emotional impairments. We provide workers' compensation for someone who may fall on the job and sprain their arm, yet we don't provide workers' compensation for someone who has been injured and is suffering mentally due to high exposure of tragic incidents or who are subject to continual emotional distress. The professions identified in Bill 666 are forced to manage an unusual amount of intense stress, soaring workloads and emotional challenges, and significant incident after incident of exposure to very difficult scenarios. While 666 identifies those professions that are impacted most, we should be taking a hard look at evaluating all professions for the opportunity for mental health support and damages. I also want to take an opportunity to speak to something that's not in the bill that I believe is critical and germane, and that is the classification of dispatchers as first responders, which would open them up to additional benefits such as workers' compensation. While I applaud the committee's intention to provide workers' compensation for mental health injuries, I believe taking it a step further and properly classifying dispatchers as first responders would open the door to other benefits and provide them opportunity for critical training. This is a bill that I proposed in 2020 and 2021, as I feel that the current classification of dispatchers as administrative does not represent the initial exposure dispatchers receive and the life-saving tactics that they need to deploy instantaneously. They are the first to react to an emergency. A mother who may call because their baby is not breathing and the dispatcher has to walk them through the process, and sometimes the child doesn't make it while they're on the call, only to pick up the next call, which could be somebody who is suicidal, the next call, unfortunately, which could be a school shooting, an accidental shooting, a car accident, and the list goes on all day long. Sometimes it's difficult for us to even listen to these situations. Imagine getting thousands of calls of this nature daily. And that brings me to the volume that our dispatchers receive. According to DESK, in our state, we received 1,900,000 calls to our dispatch centers in 2020 across Connecticut. That's roughly 5,200 calls a day, each call by nature being a distress call. Several states have already passed legislation reclassifying dispatchers, including Texas, California, Pennsylvania, and there's pending legislation in additional 6 states, including New York and Georgia. There were 2 bills introduced on the federal front regarding reclassification, but they were cut short in 2020. Yet here in Connecticut, 911 dispatchers and telecommunication workers are classified still as administrative support. We should not be waiting for other states or a national queue. We should be blazing the trail in Connecticut. This classification will help allow dispatchers the right to more critical training, whether it be training for an active assault or a mass casualty incident. A change will open the doors to more critical training and the opportunity for the community to serve the communities that they serve. A perfect example of lack of classification didn't allow our dispatchers to receive vaccines in the first round. I want to thank a few dispatchers in my district who have been strong advocates for this change: Ray Memick, Katie Vicellio, and Jennifer Amendola, who has been a manager of the dispatch center, along with the thousands of dispatchers across the state who have continually lobbied us as legislators for this change of action. They would have liked to have been here to testify themselves, but some of them are working and some of them did just receive their vaccine and are managing through that. Jennifer, along with other dispatchers, have written testimony, which I would point you to, which gives examples of what they endure daily. In conclusion, I support providing mental health compensation for these professions. I support recognizing PTSI for these professions. I ask that you look at other professions. And finally, that you take a hard look at the classification of dispatchers. I also want to say that while my testimony focuses on the dispatchers in 666 and 660. I also have written testimony in favor of SB 141. Thank you, and I look forward to working with the Labor Committee in discussing this legislation and helping to secure its passage.